Honorable Pro-Chancellor Sir, members of high tables, invited guests, my fellow colleagues, ladies and gentlemen, good morning and assalamu alaikum. It is with humility and immense gratitude to Almighty God that I stand on this podium to represent the Department of Nursing in Integral University, Lucknow, India. My name is Abubakar Usman. I'm here to deliver a speech which says the role of nurse in healthcare system. But before I proceed, I would like to highlight what is nursing. Nursing encompasses autonomous and collaborative care of individuals of all ages, including groups, family, community, sick or well, and in all settings. This is what nursing is all about. So, within a healthcare system, nurses mainly focus on helping the patient to meet their needs, including physical, social, emotional, cognitive, and spiritual. Nurses are there when the first breath is taken by ensuring that they save the lives of new individuals. And also, nurses are there when the last breath is taken by giving hope to the terminally ill patient. Although it is more enjoyable to celebrate the birth, but it is also important to provide comfort in death. Nurses plays a multiple roles in healthcare and hospital, depending on the unique need of the patient at a given time, such as nurse as communicator. Nurses are responsible for communicating with the patient by clearing their doubts because if communication process is not effective, then healing process will be inhibited. Nurse as a patient safety. Nurses are patient safety because when the doctor visits or diagnoses, it is the responsibility of the nurse to prevent medical error and ensure that the patient takes the correct treatment at the right time. Nurse as a caregiver. Nurses act as a patient caregiver because they help in managing the physical need of the patient, preventing health illness, and making sure that the patient is able to understand the proper treatment which he is taking. To do this, the nurse needs to observe and monitor the patient to record the relevant information which will help in treatment and decision making. To this, I will say that nurses take care of the patient in the hospital, just like the mother take care of her children. Nurse as health educator. Nurses are responsible for ensuring that the patient are able to understand their treatment, medical illness, and to the best of their ability. This is one of the essence during the discharge process because the nurse will make sure that she educates the patient that he will know how to take his medication even if when he is not in the hospital. Nurse as patient advocate. The patient is number one priority of the nurse because the role of the nurse is to advocate to the best interest of the patient, to maintain the patient dignity during the treatment process and care. In this, what I'm trying to say is that the nurse is always there to advocate to the patient and to make sure that the dignity of the patient is being maintained during the care or during the treatment. Then nurse as a researcher. The nurse applies a research on the bedside of the patient by providing intervention that are based on current evidence. Just take as example the current situation we are in now, pandemic, which is the COVID-19. The nurses were there right from the first day when COVID-19 was announced, and they are still there till up till date. And they are involved in making research related to coronavirus and how to elevate anxiety to those patients who are affected, and to elevate anxiety to the relatives of the patient. This is one of the main essence of nurse as a researcher. Nurse as manager. The fundamental to nursing practice is the role of nurse leader as manager. It involves pulling together people with common goal of caregiving. The nurse as a manager put effort to make sure that he provide people who are very effective in giving care to individual. The nurse as mentor. Mentoring another nurse is a professional means of passing along knowledge, skills, behavior, values to the less experienced individuals. In nursing profession, we have nurse as a teachers. A nurse is responsible to make sure that they mentor the less experienced individual who are coming up or who are trying to become nurses. So they elevate and give them the behavior because behavior and skills, this is one of the major things that is important in nursing profession. With experience only, we can relieve anxiety to the patient. In conclusion to my topic, nurses are assumed a variety of roles and functions such as caregiver, leader, change agent, teacher, manager, case manager, counselor, client advocate, research consumer, and more contemporary roles keep assuming in nursing profession. All I'm saying here is that caring is the essence of nursing. Once again, I still remain Abubakar Usman from Integral College of Nursing, Integral University in the Thank you.